the Sullivan County Legislature. On behalf of the Sullivan County Legislature, we welcome you today to this Facebook live streaming event. We're going to provide information on the COVID-19 health pandemic in our county. We've gotten a lot of questions, and we're going to answer more. Actually, we have more than we had last week, so we're going to do our best to provide the information to the folks here in the county. With me today is our county manager, Joshua Potosek, our county sheriff, Michael Schiff, and our public health director, Nancy McGraw. We're going to start first with the question, how many cases do we have currently confirmed? Given our low rankings, why is that lower than surrounding counties? Nancy?
Good afternoon. Sullivan County is currently up to 106 confirmed cases, and there's really no correlation to our county health rankings. That's a separate issue. I will say, however, whenever you have a population that is exposed to an outbreak of any kind, if you have a lot of people who have immune compromised conditions or larger numbers of people with health conditions, there is a potential that there's a higher risk. But our population cannot compare to surrounding counties. So 76,000 people in Sullivan County, that's why we have a lower number of confirmed cases.
Okay, next question. In Sullivan County, how many people have been tested and how many have died? Nancy?
So the good news is that we have had 526 people test negative to date, and that's a total of 632 individuals being tested that we're aware of. The very unfortunate news is that we did find out about the first confirmed death of a resident in the county very recently, and we want to send condolences to the family. And those family members are currently being notified, and we won't be releasing any additional information.
Thank you, Nancy. Why doesn't Sullivan County have a map that displays town-by-town cases like Orange and Ulster do? Can public health and local government make residents aware of specific areas where coronavirus may be prevalent as a way to protect others, not to cause a panic? There is hearsay information of specific communities that have clusters of cases. Nancy?
So the first thing I want to say is that we've been discussing this with our team quite consistently over the last week, and we've been debating the pros and cons of releasing information on a map. The important thing for people to know, and the really critical message we want to get out, is that maps and data can be misinterpreted, can be misused, and we want to make sure that people understand that their general risk with this outbreak is the same no matter where you live, that it's important to use social distancing and washing your hands. We will continue to look at the map issue, and when we're ready in terms of releasing that information, if it serves a useful public benefit, we will be doing that.
All right, thank you, Nancy.
Yes, the map up here. In terms of what we have available to you is a county dashboard. So we're starting to get out a lot of the data that will be updated on a regular basis. Currently we have a number of cases since the beginning of our first case in Sullivan County, number of positive versus the number of people who have been taken off of isolation. So of those 106 cases that are confirmed, 34 of those people on mandatory quarantine have resolved and are healthy and are no longer on quarantine. So we'll continue to be updating this, and we'll be adding other data sets as well to keep you informed.
I'd like just to add, before we go to our next question, that the legislature has been discussing this matter. We're still getting some data, and while some counties are providing that information, others are not. So I think they're in the same boat as we are, quite frankly, going over the data and getting it ready. So if and when that does get put out, it's put out in a way that we have all the information in its totality before we release it. The biggest thing out of all this is just to continue to do the right thing, the social distancing, making good judgments. That is what we need to do. Next question. This is also for Nancy. And this is our most asked question. What steps have already been taken and what is currently being done to protect those who are here from COVID-19 spreading into our area from outside Sullivan County, particularly when the summer arrives and our population increases?
So a lot of what you've seen happening around the state has definitely already taken place in Sullivan County. And that is the social distancing measures, the governor's executive order, furloughing certain workers if they're not essential, working from home if possible, hand washing, prevention measures, and I will let the sheriff add some additional information if he would like to speak to this question.
Yes, we're trying to get information out to different communities around the county. In the summer, we do have a great influx of summer residents, all different ethnicities, all different groups. We're trying to get out through the towns the information to people. If they do come up, if they're coming from an area where there is a hot zone, if they've traveled to a hot zone, to follow the precautions, quarantine themselves, try to stay out of the community, follow all the precautions that Nancy has talked about. One of the big fears up here that has been brought to our attention, of course, is the summer camps coming up. We have some Jewish summer camps and we have some regular summer camps. Our understanding is none of them are opening. We've talked to our liaisons within the communities, and we have not found that to be untrue. Last week when we were on, I asked anybody who saw activity in a camp to give us a call. We did get several calls. We followed them up. There were no people coming up to the camps. That offer is still open. You're our eyes and ears. If you see something out there, if you see a camp coming, it looks like it's coming online, that they will be populating it, let us know. We did have one glitch with a yeshiva. There was a misunderstanding. They were contacted, and they are complying with what they're requested to do. So we have not been hitting any brick walls. Everybody is trying to comply. Everybody is trying to do what they're being asked to do. And all we can do is stress those safety measures that we keep talking about. Safe distance, wash your hands, be aware of what you're handling, don't touch your face. And all we can do right now is just keep pushing that message. But for the summer, I think we do have summer residents coming up that own houses. And as we said last week, those people pay taxes, they own the residences. And I have gotten some complaints from some people on that. But in the same breath, they're telling me they had a cousin or a nephew or somebody who came up out of the city to get them out of there to come up and stay with them. So I would look inwardly when you start looking out and saying this group or that group. Think about how you conduct yourself and what you do for your family. These people own these residences, and I don't think we should be denying them access to where they live. What I'm seeing, as I said last week, as I travel around Walmart, ShopRite, different places, Home Depot, I believe these people are coming up and quarantining themselves to a large extent. I'm not seeing them out and about. I know in the Jewish community, they are delivering food to a lot of those communities so that they are not mingling with the general public. So I think they are complying as much as they can, and they're being fully cooperative. So I would try to take it down a notch for people that are getting worked up. We had a call yesterday about a caravan coming up with a security guard leading it, following it. It was on the internet. We put somebody out on 17. I made some calls. We didn't see a caravan. They said there was no such thing happening, and that appears to be the case. So I think a lot of people are getting very worked up, understandably. This is a serious matter, but I think we all need to stay calm. We all need to be thoughtful about our actions and try not to take actions into our own hands. If you see something, contact the county, contact Nancy with public health, contact your local law enforcement, and we will look into these issues and we will handle them.
Okay, next question. And I think our sheriff spoke to this to a degree. But the next question, on March 20th, the town of Fallsburg supervisor suspended certificates of occupation for camps and bungalow colonies in the town based on Governor Andrew Cuomo's ban on gatherings of more than 50 people. And Cuomo's recommendation that groups of more than 10 people should also be avoided. Will Sullivan County do the same for the entire county? Joshua?
Well, the simple answer is that Sullivan County has no ability to effectuate that at this time. So to kind of explain what the governor has done at the state level, because this is such a statewide issue, he's taken the power away from local counties and towns to issue unilateral orders without their approval. The reason is he wanted to have a unified response because it is a statewide issue and it's not a small storm or something that a local county can deal on their own. So he did that primarily because of the schools, where we had a bunch of different counties closing schools for different durations. So he basically preempted any local government from issuing their own executive orders that deal with the coronavirus issue. And just to clarify some of the things in that question, the state executive order currently prohibits any gatherings of any size that are non-essential. So it's not a recommendation. There are to be no gatherings in the state of any size at this time.
Thank you. Next question for the sheriff. What is being done to curb anti-Semitism during this time as it relates to camps and bungalow colonies?
As I said in my previous answer, we're trying to curb any anti-Semitism. I don't think we should have any prejudices towards any group. We really have to be thoughtful in a time of crisis like this. And what do we do for our family? Any other group is the same as us. They're going to look out for their own. All I can say is right now, all I've heard is a lot of urban legend, speculation, and misinformation. Everything we've run down, except for one thing that was a misunderstanding, has been resolved, and so far we're getting nothing but complete cooperation. So if we all keep our heads, if you see something, you hear something, let us know, let the county know, let Nancy know, and we will look into it. But there's nothing I can do about what's in people's hearts. If someone is anti-Semitic or anti-Muslim or anti-Asian or anti-Hispanic, I can't fix that. But what I can say is just try to keep your thoughts of what would you do for your family in this crisis and have a little latitude. There's only so much we can do to control people. The governor has the controls on that. Whether there's a travel ban, we can't completely restrict people. We are doing what we can through education, and we will continue as a team. The county has been stepping up through the EOC, through all the county entities, and we will continue to do that. And again, all I can ask is if you hear or see something, don't get worked up, don't take things into your own hands, just pass it up the pole. We will take care of it.
And remember, everyone, we are one people, and together, we will get this. We will get past this. It's so important. This is not the time to start segregating your thoughts, this one and that one. That just causes the. Not only does it get people, basically thinking about the wrong thing. Right now, the attention is on COVID-19, not on anything else. Like I said, we are one people, and we need to come together to get past this sooner rather than later. Next question. Are any measures being taken to prevent Airbnbs and other home rentals from allowing visitors to rent for less than 14 days? Josh?
Again, this kind of touches on my earlier response about how the state has preempted any local orders. So, no, we can't prevent that. We're not looking to prevent that, but we'd ask that the people that are coming into our county, we have limited resources, so please abide by the guidance and requirements of the state, the federal CDC about you shouldn't be leaving your house unless you're an essential employee, going to a grocery store or to a medical facility. So as long as people abide by that, we welcome people as long as they stay in contact and abide by those state and federal regulations.
Thank you. Next question. Is there sufficient protective personal equipment, PPEs, for our hospital and EMS workers? Is any protective gear being distributed to workers at our grocery stores and gas stations? Nancy?
So first of all, the short answer is no. There's not enough PPE, and that's a statewide issue. It's actually a national issue. But here in Sullivan County, we're continuing to reach out to get PPE from various sources. I want to point you to the dashboard. We're keeping track of this data here at the EOC in terms of PPE status for the hospital, for the adult care center at Sunset Lake Public Health, the nursing homes in the county. the Hudson River Healthcare, and the Center for Discovery. So they've got less than a week left if they continue to use at the current rate. So I want everybody to understand that there is a much larger team here than the individuals who are speaking to you today at the Emergency Operations Center. And there's a whole lot of people working on obtaining PPE requests through the State Office of Emergency Management. We received a phone call today from Operation Endeavor. The county did receive some donations from Home Depot of 800 masks, N95 masks, and those were distributed through the inventory here. Over 2,400 N95 masks were distributed already over the last 2 weeks out of inventory through the EOC. 2,000 surgical masks, gloves, gowns, and ponchos. And so we want to make sure that we prioritize for our hospitals and our healthcare workers, our first responders, EMS, law enforcement that are out in the field, our public health nurses who are still out there making home visits, and nursing homes. In terms of gas stations, grocery stores, we encourage them to try to get what they can through their vendors and supply chains, and the county is not in a position, unfortunately, to distribute gloves and masks at this time to private business.
Stay right there, Nancy. I think you touched on this, but just as far as the N95 masks, there was a question, have you tapped local hardware stores for N95 masks? You answered that. But on the other end of that was people are reusing their N95 masks during this shortage. Is that safe? And
Unfortunately, if the masks get to a critical point where they have to be reused, there is guidance for healthcare workers on this issue from the Centers for Disease Control on reuse and safe reuse. So we can point folks to those resources. They're on cdc.gov, and there is a lot of information there on this topic.
thank you. Next question. How are you keeping your sheriff's officers safe? Not just in patrol, but in the jail. Have any prisoners been released from the county jail due to coronavirus? And how are you keeping prisoners at a safe distance? Sheriff?
I'll try to remember all those in sequence. As far as keeping the deputies safe, we do have gloves, we do have N95 masks. They're in short supply, we are rationing, but we make sure that every deputy has gloves and masks available to go out on calls. For the jail, the same thing. In normal interaction, they don't wear masks and gloves. The jail facility up until now, we do not have an active case, and we have changed our protocols within the jail. Any people coming into the jail, we used to have to break down by classification. What we have done is, prior to going into classification now, everyone is quarantined in E-block. So it doesn't matter what you were arrested for, you're put in E-block for 14 days to see if you show symptoms. If you show symptoms, we will take appropriate action. We have not had that up to date. Everybody coming in and out of the jail personnel, medical, civilians, like for DPW, their temperature is taken. And we had to send a DPW person back out because they were running a fever. So we're taking precautions. And about 10 years ago, we had a horrific flu season. And we started wiping down all the railings and doorknobs in the facility twice a day. We have now upped that to 3 times a day. So those are the precautions we're taking to protect our deputies and the inmates in the jail also. We're obligated with protecting them as well as our deputies.
Okay, next one's for you also, Sheriff. With visitation suspended at the jail, are there any other ways prisoners can communicate with families?
Yes, because of the visitation being suspended, we suspended out of county first so that we weren't bringing the virus into our county and into the jail, and then we suspended visitation. At this point, the jail administrator, Hal Smith, is allowing extra phone calls and allowing extra mail to go out. So we're trying to do what we can to allow communication with their families and relax some other things also. We understand what kind of tension that can create, not being able to see your family members or loved ones, but no different than what they're going through at the adult care center, and everybody at this point just has to live with that and get by it.
Thank you, Sheriff. Next question goes to Nancy. A lot of questions within, so bear with me, it's a long question. What is the availability of testing locally? What labs have been identified to run results? And does it take over a week to get results? Or are faster testing kits available? How many test kits have been issued to Sullivan County Public Health Services? And will we be getting any drive-through centers?
So currently, the testing availability in Sullivan County has been through Catskill Regional Medical Center primarily. They have a testing tent outside the emergency room. And people need to call first and be screened because they are following the priority screening protocol set out by the State Health Department in terms of conserving resources, making sure that you have a fever, cough, and symptoms, and if you've been exposed to a known positive case. Individual risk factors as well in terms of any other underlying health conditions. So we're not testing anybody who wants a test. I want to reinforce that from what we said last week. It's simply not available, and this is a statewide issue. In terms of the rest of the county, there are other healthcare providers who are testing their own patients based on the same clinical symptoms and risk factors. So if you're already a patient of a provider at Hudson River Healthcare or Crystal Run Healthcare or the Greater Hudson Valley Healthcare System, we ask that you contact your provider if you have concerns and need to be tested. In terms of public testing, there are some drive-through centers being set up in different parts of the state. That is a state health department decision. There is one that will be operational and active in Ellenville, I understand, this week. And those resources and those decisions are made in conjunction with the county officials, county health departments, and the state health department. Currently, we are in discussions with the state health department about the possibility of having a drive-through test site in Sullivan County, but that decision will be not made anytime soon that I'm aware of. We've started those discussions. And Sullivan County Public Health does not have any test kits, so we were not given testing kits. We're not expected to do testing. We have really reserved our resources for the case investigations and containing this outbreak, and our nurses continue to do home health visits to our current home care patients. If it becomes available and we're asked to do that, we do have the capacity to stand up a pod or a point of distribution to do a clinic if we're asked to do that by the state health department and that becomes necessary.
Okay, next question. Don't go too far, Nancy. We have quite a few questions in a row here for Nancy. Can you explain the capacity of the local hospital, including the number of ventilators available? What are we doing to prepare for an influx of hospitalizations in terms of supplies and planning?
So currently our local hospital, Catskill Regional Medical Center, has 10 ICU beds, and that's for critical patients. The total capacity of the hospital is much larger than that, obviously, but if we're looking at critical care, we're looking at 10 beds, that's it. 12 ventilators are available, and 6 are currently in use. So this really underscores what we've been telling people in terms of isolating at home. If people come here, in terms of seasonal residents and visitors, we want to make sure that you're healthy when you come, quarantine yourself. Should you need medical care, please understand that our capacity is very limited.
Okay, next. Have you secured suitable convertible medical sites? Should there be an additional need for inpatient beds? Will the National Guard send medical teams to administer patient care if additional space is needed?
So we're following the governor's plan in terms of identifying possible locations as part of our emergency planning at the EOC with our team and looking at the possibility of sharing resources with other counties, with other hospitals. There's a lot of discussions in progress, and this also includes establishing our own field site for hospital extended surge capacity should it become necessary.
Okay, should people, especially senior citizens with a cough, fever, shortness of breath, go to the ER directly or call ahead? What phone number should they use?
So if anybody is experiencing, especially senior citizens, the symptoms of COVID-19, cough, fever, shortness of breath, you shouldn't wait to make a phone call. You should call 911, discuss your symptoms, and see if you need medical care. Should you need an ambulance, one will come to you. Please let them know about your symptoms so that our EMS providers can be fully prepared to protect themselves. If you are in a situation where you're able to be driven by someone to the hospital, we ask that you go and be evaluated. Please call them ahead of time. And the number for the emergency room will be shared. I don't have it off the top of my head.
Okay, thank you. Another one for Nancy. What are private businesses required to do to protect their employees? If a business that is believed to be essential remains open, is closing the door to the public a sufficient measure of protection? Is it mandatory that if a business has a capability to work remotely, that they allow their staff to do so?
So a lot of private businesses considered essential have continued to remain open, and that's really important, so that things like food and commerce and other things can continue to be provided to the public, gas stations, restaurants who are doing delivery or takeout. That's really important. It not only supports the business, but supports the local, the public. We ask that they continue to just follow the general guidelines that everybody else is in terms of hand washing, frequent hand washing, social distancing within their business as they continue to operate, masks. I've seen gas station owners wearing masks and gloves. And so if businesses can do that, we really encourage that. And also we've provided guidance for daily sanitation and cleaning of businesses. And if anybody still needs that, we certainly will, it's on our website, but we'll push that out again. We've shared that through the Sullivan County Visitors Association and Chamber of Commerce. And so we're doing everything we can to encourage businesses to continue to operate. If, depending on the type of business, if they can allow their workers to work from home and that's feasible, that certainly supports the importance of people being able to isolate at home as long as possible, especially if they have an underlying health condition or they're caring for someone who does.
Okay, next question. This will be for Josh. Are landscape and general maintenance businesses considered essential?
So the governor, through executive order, has defined what are essential services, and you can find that on the governor's website. He's tasked the Empire State Development Corporation of the state to make those final determinations. So if a business has a particular question on can they be open as an essential business, I direct them to the Empire State Development website. It's esd.ny.gov. So if you have particular questions, they would be the ones that you would fill out a form and they would answer based upon your responses if you are an essential business or not.
Thank you. A question for Nancy. Should we be concerned about handling the mail and other items delivered to our homes? And if so, what precautions should we take?
I know there's been a lot of speculation out there on the news about this. What we do know is that from the current, and this could change, but from the current research and evidence is that yes, COVID-19, the coronavirus that causes COVID-19 can live on surfaces for, depending on the type of material and how porous it is, for hours to days. So this is why we encourage frequent cleaning in the house. In terms of mail, I wouldn't really be extremely concerned about it unless you have someone in your household or you yourself are immune compromised. Then I would be a little more careful. You might want to wear gloves, but really contact your healthcare provider in terms of trying to determine your own risk level. And look at the World Health Organization and CDC websites, because those websites are being frequently updated with the latest research and new information comes out all the time. And so you can try to determine what is a myth and what is fact. But so far, we are seeing that this virus can live on surfaces for hours to days.
Okay, Nancy again. How long does the virus live in the cold, or for that matter, the heat?
So again, this is another research question that's evolving, but the idea that the virus will be destroyed by the cold or the heat is really a misnomer. It's a myth, and the research is evolving. We're continuing to learn about this. So again, check those websites.
Thank you. Next, this is kind of a personal question somebody had sent in. Myself and a few other family members were diagnosed with bronchitis at the end of December. A good percentage of these people never had been diagnosed with bronchitis ever until last December. Do you think it was COVID-19? And if so, can we be infected again?
So the first thing I would say is you need to talk with your individual healthcare provider, because each person's risk factors and health history is different. Bronchitis tends to produce a productive mucousy wet cough, and with COVID-19 we know that that's a dry cough. But again, you really need to talk with your healthcare provider to determine your individual risk. We don't want to speculate on specific situations with certain people not having any information. Whether or not people can be infected again, we did see some stories coming out of China a few months ago where that might have been a possibility, and again, I think it's evolving, the research.
Next question for Josh. What volunteer opportunities are available, and which are the highest priority?
So obviously there's a lot of opportunities for volunteers, anything from helping our more vulnerable senior citizens to healthcare related facilities. We've manned up a call center called the Emergency Community Assistance Center, and that phone number is 845-807-0925. And they're fielding calls and taking solicitations for people that will want to volunteer, provide assistance, but also that line is also set up to help our businesses and kind of help them pinpoint and where they can require small business assistance or other state or federal aid programs to keep their business afloat while we weather this storm.
Okay. I'm going to skip a question here, and I'm going to go to a question here. Where do we interact with county officials on Facebook? Nancy or Josh?
Obviously, we're through our chairman, Rob Doherty, kind of spearheaded and required us to do this. It's a great idea, and we're going to be doing these 3 times a week. So if you have general questions, you would pose them to our general Sullivan County Facebook page. Obviously, if you have urgent public health matters, you're going to call the public health line at 292-5910 or the ECAC number I just said if you're a small business. Don't wait for these town hall type meetings. If you have an urgent need, call one of those 2 numbers. But these are set up more for 3 times a week, more general questions that we're going to field as many questions as we can through that Facebook, Sullivan County Maine Facebook page.
All right, and our last question today. What are our legislators doing? As you know, each one of the 9 of us, we represent a district in Sullivan County. And each one of us have been taking calls from residents of their respective districts. And some of us have reached out to the supervisors on an as-needed basis, and just to have a conversation and communicate. And so basically, we are supporting obviously the operations at the EOC, all our county workers, the healthcare workers, the first responders, our law enforcement. All these folks have been it's impressive with the work they're doing, the people that they are helping. And so as a legislature, not only, part of representing people is just to keep the lines of communication open, and feel free, legislators, I know we've been getting calls, I have, others have, and anything we can do to help. But that's our role. Meetings, we have a meeting scheduled in a few weeks. We'll have to see how things go with respect to the coronavirus, how that meeting will take place. If we need to, we can call emergency meetings. So we're here, we are governing, but we're also supporting. And I can't emphasize enough, it's amazing to see the people of this county coming together as they have. And we're not over this yet. And the hope for everybody is that we'll get over this sooner rather than later. But the only way that happens, I'm going to say it again, is everybody working together, good judgment. Remember, we're in a free country. I said that last time. But with that freedom comes a responsibility, a personal responsibility. So please keep that close in your heart. And if you do, I think we'll get through this sooner rather than later. Thank you. Have a good afternoon.